Health experts are warning that your summer cold could actually be COVID-19. There has been a slight increase in COVID, but it is still far less severe than anything we saw the last few summers.
Fox 9's Rose Schmidt is here to explain what doctors are now recommending, Rose.
Yeah, well, it's possible you've never heard of XBB, but that's the dominant variant in local wastewater. And there will soon be a booster that protects against it.
At the moment, it's more an anxiety than it is a reality.
Allina Health's Dr. Frank Raim says there are very small indications of more COVID-19 activity around the country, and it's picked up slightly in the Metro's wastewater data.
But it's a real anxiety because it's still a bad disease and there's still plenty of it around.
Doctors are in a wait-and-see mode to find out if COVID develops the same way other respiratory viruses do. It'll likely become more clear as we approach back-to-school time and people crowd together more. But Dr. Raim says the current booster protects against strains that were circulating 18 months ago.
So I would say don't get the bivalent booster now because that might force you to delay getting the new one in the fall, which is going to be the best one to get.
That fall booster will protect against the current strain, XBB.
And this fall, we're going to have 3 vaccines on hand. We're going to have COVID vaccine, we're going to have influenza, and we're going to have RSV vaccine. And exactly for whom they're going to be recommended is not yet decided.
As for whether your summer cold is actually COVID instead, you really can't tell without getting tested.
And you should know what it is, because if it's COVID, you really should stay home for the first 5 days, and then you should wear a mask for the next 5 days.
He says getting tested is especially important if you're around elderly people and people with weakened immune systems. Back to you.
All right, thank you, Rose. Well, a big